All right, everyone. And we are live. Just going to wait here to make sure, things start streaming on all the right platforms. And I believe we are. So, hi, everyone. I'm Dr. Funke Afolabi Brown. I am checking in again. Listen, I made a commitment, and that commitment was to show up every day this week, just for a few minutes, and just share some of my thoughts around sleep in children. I'm a sleep physician. I have expertise in sleep in kids as well as adults, but I really have this passion that motivated me to write a book, Beyond Tired, which is a sleep physician's guide to helping your child solve your sleep problems for good. And so on Monday, which was 2 days ago, I shared a lot about what was it that motivated me to write a book specifically for sleeping children. And then on Tuesday, we went ahead to talk about who would a book on sleeping kids be suitable for, right? Like, duh, everybody, right? So we talked through all of that. And today, I want to just share about a few things by which you can tell if your child actually has a sleep disorder. Okay, so here I am to tell you that not every child that has sleep issues has a sleep disorder. And if your child has sleep issues, it's not necessarily a sleep disorder, it doesn't mean they have to just keep struggling with that. So the reason why I want to highlight that is that if your child is struggling with their sleep, and for instance, you see their doctor, and the doctor tells you, well, they don't have sleep apnea, or, they don't have any of the common reasons from a medical standpoint why your child should be struggling with sleep, that doesn't mean you have to just take that and be like, okay, well, it's not a medical sleep issue, so there's really nothing to do. I think this is really an important point. And the reason why I think this is so important is because I have a lot of families that show up and say, well, my child's been struggling, but they didn't really find anything. And so, here we are. And I'm here to just empower you to say, keep pushing, keep advocating, try to be like that detective and advocate for your child, because there are many things that may be going on, and it may not necessarily qualify as a sleep disorder, but that doesn't mean your child needs to continue to struggle like that. So if you're here on live, definitely wave, let me know. If you're here watching a replay at some point, please put hashtag replay. That way when I come back, I could say hi, thanks for joining. And really, one of my missions is to empower families, because we have seen people are beyond tired. Like, we're not just tired, we're beyond tired. And so if we could take this big piece of the puzzle out of the way in terms of figuring out what to do to improve sleep in kids, I'm telling you, that is a big chunk. Okay. So here are some things that I want you to focus on when we think about what could be going on with our kids' sleep, right? Number one is the quantity. Okay, what does that mean? Based on age, based on phase of life, your child's sleep needs will vary. And I think it's so important for us to understand that, because if we don't have those expectations clear, we might actually be worrying when we shouldn't worry. Or we might actually think, oh, it's okay. I have a, 2-year-old that only sleeps 7 hours, and I guess, that's where they are. No, 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 no. It's something that we really need to understand. So that's number one. How much sleep is your child getting? Because if you notice that your child is tired during the day, they are irritable, something, they're just off, I want you to pay attention. Like, how much sleep did they get? And maybe compare it to, like, maybe on the weekends when, things are a little bit lax and they can sleep in, and see how they are in comparison. The reason why this is important is that young kids need a lot of sleep. And as they get older, they still need sleep, but maybe a little bit less. And we have the research that shows that almost 60% of kids in middle school are not getting sufficient amount of sleep. And what's that number? It's about 9 to 11 hours of sleep. So your child in, fifth grade, in fourth grade should be getting that amount. And high school kids, almost 75% of them are not getting enough sleep. So what's the recommendation in that age group? It's between 8 and 10 hours of sleep. Okay. So your toddler, your little one will probably need anywhere from about 11 to 14 hours. And then, your preschooler about 10 to 13 hours. And then your babies need 14 to 17. Now there's a wide range. And I usually compare this to like your shoe size, right? Your shoe size will differ based on age, right? So your little kid will need a little shoe size, your older kid will need bigger ones. So kind of the flip is the way it is for sleep. So it's important that you pay attention to that. And I can tell you that might be where the issue is. That might be actually the sleep issue. They are not getting enough sleep. And so you may just need to figure out how to make sure they get enough. So, I usually will say don't go like from maybe they're only getting 8 hours of sleep and they should be getting 10 hours of sleep. It's going to be hard for you to just push in an additional 2 hours if you're super busy to figure out where are we going to fit that in. And also your child's body may not be used to that big change, and so they may end up tossing and turning. But build small increments into it. So maybe add 15 minutes, go to bed about 15 minutes earlier for the first couple of days, and then increase that gradually. And then you look back at the end of a week or two and say, oh wow, we're now at our goal. And then you kind of check in and see how are they doing based on that. So now we figured out that they were short on sleep. We're giving them enough sleep now. We're making sure they get enough sleep. How are they? If they're better, guess what? Problem solved. You're done. If they're still struggling, say they're waking up and they're still tired, they're irritable during the day, right? And it's it's not necessarily related to them being hungry or something like that, right? Then you want to start to think, okay, what about the quality of their sleep? Right? Is anything going on with their sleep quality? Are there things that are going on that could be fragmenting their sleep? And here is a whole bucket of things. Like literally, there's so many things that could be going on that could be disrupting your child's sleep. It could be something like, sleep disorder, right? Which we initially talked about, right? It could be that they have sleep apnea or restless leg syndrome, or they have eczema. Eczema is something that is often ignored, not really ignored. It's just not recognized as a big sleep disruptor. So if your child is, itchy at night, they may have very disrupted sleep. If your child has reflux, if your child has asthma, and of course is coughing all night long, they're definitely not going to sleep well. I see one other reason why a lot of kids may struggle, a lot of parents would struggle, especially in kids who have maybe autism or some neurodiverse conditions or some delays. Many times these kids could be constipated, and that is something that is often under-recognized. And they may not necessarily be verbal about it. They may not be able to express how they're feeling. And constipation can keep you up at night. You all know if you need to go, you have that discomfort. So if your child is backed up, you want to pay attention to that. Now, the other reasons, right? Your child might have insomnia where they have difficulties with maintaining sleep. Maybe they fall asleep okay, and now they're waking up multiple times at night and they're kind of walking around the house, coming to get you in the bedroom. Then the kind of sleep they're getting overall may not be the best quality. And so you can see that there are so many reasons. Sometimes they may be drinking caffeine. So you want to consider that. What's their environment like? Are they sleeping in a room that's cool? Is it dark enough? Are there, or is there access to light, subtle light exposure that might be disrupting their sleep quality? Is the room too hot? If the room is hot, then the sleep quality is going to be off. Are they drinking caffeine? Listen, that is so common. In fact, no judgment here. But I had a 2 year old with a feeding bottle who had soda. No, it wasn't soda, it was iced tea, right? So we just really have to be aware of that. Like kids and caffeine, not usually a good mix, especially if they're struggling with their sleep. So that's somewhere you want to think about. So even if they don't drink coffee or, tea, they may be having soda with dinner or iced tea. And what that does is it disrupts their sleep quality. So that's something you want to just check as well. And then if you've looked at that whole picture, now with the sleep quality piece, of course, there's some basics, right? We talk about the healthy sleep habits, the sleep hygiene, you check that off. And they are still having issues. They're still waking up tired. They're still really having meltdowns during the day. You notice, like, by the time it's evening, they're exhausted, they're cranky, they're irritable, or they're struggling with school. Then you need to speak with their doctor. You need to speak with their pediatrician to say, can you just look at this Let's look at this globally. I think this is so important. Before we go grabbing stuff from over the counter, like supplements and sleep aids, let's just make sure that there's nothing medical that we are dealing with in that kind of situation. So I think this is so important. And then the third thing I would say is the timing of their sleep. Now, I see this a lot more in adolescents and teenagers where we are trying to get them to sleep at a time that's completely misaligned with their circadian rhythm, which is that internal clock. So you're trying to get your 14-year-old to go to bed at 8 p.m. or something. Like, that's not going to work. Their body shifts. And so they have this delay in their circadian rhythm. And so that might be the reason why they're not sleeping well, because they're being told they need to get enough sleep. So they're going out to sleep, they're going to bed, but they're tossing and turning. They're not falling asleep till like 10, 11, maybe 12 midnight. And then they have to wake up early again to go to school. So that might be something you want to look at. And what would you do with that? I mean, I think there's some strategies, and we provide that extensively in the book Beyond Tired, where what are steps you can take within your control to help your child who may have maybe sleep rhythm issues, to help them tackle their sleep struggles. So that is something that you also want to look at. Now, in terms of other things that you want to do, I think you want to just make sure that you're advocating. I can't say that enough, because sleep is such an incredible tool that makes a huge difference in the lives of our kids. We want our kids to thrive. We want them to live long, to live well, to achieve their fullest potential. But a tired child is not going to learn well. A tired child is not going to develop well. So be that advocate for your child. Keep looking at it. And I would say, especially because I see this literally almost every single day that I'm in clinic, a child who maybe has a recent diagnosis of ADHD, or they think he has ADHD or something of that sort. And we check out their sleep and they are not sleeping. They're, like I said, they have issues with the sleep quantity. They're not getting enough sleep. They have issues with the sleep quality. The quality of the sleep is off. They have issues with the timing, and so this is something that really, unless you're looking, unless you're intentional, you might not notice it. So I really want to empower you to make those decisions from a place where you're enlightened. And I really believe that the book Beyond Tired provides you with those tools. When you're like, I think something is off with this kid's sleep, but I'm not sure. And I'm told it's okay. I wonder, Beyond Tired, a sleep physician's guide to helping solve your child's sleep problems for good, will provide you with the tools you need. One, to figure out what is going on. All those things I talked about, we elaborate on it. We talk a lot. We delve into so much detail about it. Listen, this is like a 15-minute or even shorter live that I'm coming on to share with you. And if you follow me on social media, I'm constantly sharing tips. I share tips on my YouTube video. I share tips on my blog, newsletters. If you subscribe to my newsletters, you'll get all those tips. But with this, we cannot put it all together for you and we hand it over to you so that you can then figure out, oh, this is what's going on. And then you could kind of follow this logically. It's literally a comprehensive guide that would get you from having this tired child, this irritable child, this child that's not sleeping well, to a child who is excelling and thriving. So when October 8th is going to be available for purchase. It's going to be available on Amazon. We have a launch party on October 8th as well at 7 p.m. It's going to be streamed on Facebook. It'll be streamed on Zoom as well as YouTube and all of that. So this way you have full access. Listen, I am so passionate and motivated to help solve your child's sleep problems for good. Why? Because when we sleep well, we thrive. When we sleep well, we radiate that inner brilliance. And when our kids sleep well, most times as parents, of course, we might have our own sleep issues as well, which may need to be addressed, but we thrive and reach our fullest potential as well. So a well-rested family is really a family that is going to do really, really well. So I definitely thank you for your attention today. I want you to join me on this journey in making sleep a thing. And until next time, I hope you rest well.